think the background to the study is that you may be aware the FDA raised some red flags about suicidal thinking with the GLP-1 JAGs. So that was one of our concerns, that these JAGs might actually be leading to adverse or problematic psychiatric outcomes. And then there was just the idea that we don't know. There was a bit of conflicting data in the literature. There's a lot of literature on this subject, but it wasn't always heading in the same direction. So we thought we'd use the big Swedish databases over a long period to check the effects in people with diabetes and or obesity who already had established depression and anxiety, what they were like on and off the JAKs, the GLP-1s, compared to, for example, other anti-diabetics. We used a strategy, as you just said there, within using each individual as their own control subject to try and reduce confounding by indication and selection bias. Um, So some cohort studies, observational studies, don't do that. Uh, they just look at large cohorts and maybe comparing at some level, comparing oranges and apples rather than each individual for himself. So we'd like to think that's a design benefit of our study. I mean, with any observational study, of course, the main limitation is that you can't infer causality. So we can't say that these are merely associations or correlations. We can't really say cause and effect here, that semaglutide is directly helping depression and anxiety, but there is an inference there that that's what's going on. Yeah, interesting. So I think two of our most striking results are on, because we wanted some real world outcomes, are on sick leave. And as you know, mental health is now pretty much the most common reason people take time off work for health. And also this earlier question I flagged about suicidal thinking and suicidal behaviors. And we actually showed there's a diminished suicidality when people are using these JAGs as opposed to an increased risk. So those are two of our more striking findings. Yeah. I think the other point is that, we're not trying to say that GLP-1s are antidepressant or anti-anxiety drugs, even though they do cross the blood-brain barrier and appear to have central effects. But in people with depression and anxiety, in people with type 2 diabetes particularly, this is going to be a useful, dually effective therapeutic option. Oh, if you look at the forest plots on the paper, this is a powerful effect. Even as authors, we were surprised by the size of this effect. So it's a 40% drop in the depression of people using semaglutide, like you say, compared to when they weren't, or a 42% reduction in hospitalization rates. So these are large numbers in this complex world of mental health. Um, and what's also interesting is it wasn't a class effect. So, for example, exenatide was not effective at all, and liraglutide was in between semaglutide and exenatide and duraglutide. So there's something going on there about semaglutide that makes it more potent, as it were, than, for example, liraglutide. Now, I know a lot of folks in America are using Monjaro or tirzepatide. Um, we didn't have enough patients in the database thus far to be able to bring that into the analysis. That's partly because it only got approval in Europe in 2022. My thinking is when you look at the meta-analyses on weight loss, semaglutide seems to have more weight loss association than the other ones you just mentioned. So maybe, like I say, it's a dual effect. If people are losing more weight, feeling better about their appearance, and their glucose regulation is improved, that itself is going to improve their mental health. So, but maybe, and this is pure speculation, if you're producing more weight loss, you're getting a more pronounced central effect, whether it's through the dopamine reward pathways or, in my view, as an anti-inflammatory. You're probably familiar with the literature on brain inflammation and being correlated with depression and anxiety. So, just like the cardiovascular benefits could be to do with the anti-inflammatory effects of these GLP-1 agents. Well, they're both pretty important, I'd suggest. Earlier work, including Marku's earlier study in JAMA, showed that alcohol misuse and then substance misuse disorder on its own was reduced with these GLP-1s. So that was sort of already understood. But we also know that, day to day in clinical practice, a lot of folk with depression and anxiety do medicate themselves with alcohol or other substances or do comfort eating. So, that's, I think, part of the story here that these medicines are useful like that. But when we excluded people from the register who were known to have substance use disorder, there was still a significant effect for depression and anxiety. So it's not wholly explained by the help with substance misuse.